Hello everybody. By now you all know that I'm floxed. And most people also know that I have mast cell activation syndrome after taking a fluoroquinolone. Because of that, recently I've received a lot of messages, regarding mast cell activation syndrome. How do you get diagnosed? What is it? What do you need to take? Blah, 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 blah. I thought this would be a great opportunity to play another game and have some mast cell activation syndrome trivia. Alright, so here we go. Number 1. True or false? Mast cell activation syndrome is the same thing as mastocytosis. The answer is false. Mastocytosis is the inappropriate proliferation of mast cells, like there's too many, whereas mast cell activation syndrome is the inappropriate activation of mast cells. These are two very different diagnoses, although they are often confused as the same thing. 2. True or false? Mast cells are a type of white blood cell and are part of your immune system. Mast cells are located all over the body except in the retina and spinal cord. They respond to both everything inside and outside the body, and they tend to be higher in numbers in areas that interact with the outside environment, like the lungs, skin, and gastrointestinal tract. The answer is true. Number 3, true or false? Mast cells are like guards at the gate, protecting the castle. When a person without mast cell encounters an illness or virus, let's call that virus an invader, the guards at the gate, mast cells, defend the person against the illness, and when the invader is defeated, the guards will retreat back to the castle. With mast cell activation syndrome, the immune system has been triggered for various reasons, and the guards at the gate are confused and do not understand who is friend or foe. In that case, they attack everyone that tries to enter the castle. Think of mast cell activation, or MCAS, as a cellular form of protection. When mast cells attack what they perceive as an invader, they release histamine and hundreds of other biochemical mediators that create inflammation. This is called mast cell degranulation. When a person has a mast cell attack, they react immediately in the sinuses, neck, throat, gut, etc. Mast cells create allergic symptoms by producing mediators. The answer is true. Number 4, true or false? If you don't have an elevated tryptase, you can't have mast cell. The answer to that is false. Mast cell activation syndrome only became a clinical diagnosis in 2016, which means it is a syndrome that is still not well understood, and testing is poor at best. Testing for mast cell is often confused with testing for mastocytosis, which includes an elevated tryptase. This tryptase testing for mast cell is antiquated because we have thousands of mediators, but we only have tests available for a dozen. Additionally, most mast cell patients have normal tryptase levels. This is because mediators are released transitorily. They are there and then they're gone, but their biochemical effects go on for hours. Think of mast cell as a cellular form of protection in the cells. That's why testing basically is useless or inadequate. Doctors that truly understand mast cell understand that tryptase is an antiquated way of diagnosing this syndrome. Instead, they will make a clinical diagnosis based on consensus 2, meaning it is a multi-system and multi-symptom issue. So if you eat and just get hives, that's not mast cell activation. But if you eat and have a host of symptoms all over in various systems, well then that may be considered mast cell. I've been to some doctors that say it doesn't matter what the labs say. If you react, you have it. If you take meds and you get better, you have it. And one of those doctors that told me that is one of the leading experts in the country, and not a Western medicine doctor or an allergist or an immunologist. It's someone that specializes in mast cell. You can probably guess his name. 5, true or false? Mast cell symptoms are the same for all patients. The answer to this is false. Your mast cell related symptoms depend on which mast cells are triggered, and that's why your symptoms can vary so widely It may seem so strange and difficult to diagnose. However, most people with mast cell feel like they are allergic to everything. They often have very few foods that they can eat. 6. True or false? You have to get anaphylaxis to have mast cell. The answer to that is false. Again, mast cell is a multi-system, multi-symptom syndrome. Try to say that a few times. Symptoms include, let's see how fast I can say all these. Vagal dysfunction, motility issues, usually need to stay away from high histamine foods, brain fog, memory issues, difficulty remembering things, anxiety, depression, dementia, sleep disorders, chronic fatigue, heartburn, reflux, difficulty swallowing, burning tongue and mouth, diarrhea, constipation, abdominal pain, SIBO, gas, cardiac symptoms, rapid heart rate, POTS, orthostatic intolerance, peripheral nervous system issues, pain, tingling, numbness, muscle aches and pains, bladder pain, pelvic floor pain, endometriosis, painful period, anything in the urinary tract, growth factors to make tumors or cysts, hives, dermatological issues. Was that fast enough? 7. True or false? Antibiotics cause mast cell. The answer to that is true. It has been reported that fluoroquinolones, especially fluoroquinolones, induce hypersensitivity reactions and stimulate mast cells in a dose-dependent manner through T-cell stimulation. Fluoroquinolones cause mast cell degranulation via MRGPRX2, which is a mast cell receptor that has been shown to mediate drug-induced pseudo-allergic reactions and increase vascular permeability and anaphylactoid symptoms. For those that debate that one, you can find the literature in the International Immunopharmacology, Volume 70, May 2019. That's it. Game over. Trivia done. If you want some more mast cell information and more mast cell videos, just let me know. I'll make them. I know way more about mast cell than I ever wanted to know. And I think you all know I've got it pretty bad. But I've come a long way, but I still have a long way to go. Thanks, everybody. Mast cell activation syndrome is the same thing as mastocytosis. Oh my God, it's going so fast. The host system and have, if you say you eat something and get a bunch of get cardiac very few, try to say that a few times.